You could read every hospital policy, save every labor position graphic, and write a beautiful birth plan. And yet, still, you wonder, but what do I actually do when labor starts? This gap is where practical birth preparation lives. A birth plan can help communicate your preferences. Birth preparation helps you practice options, how you might move, how you might coordinate breathing and your pelvic floor, how your partner can help you, what questions you want answered before you begin pushing, and how you may adapt if that plan changes. In this video, I'm breaking down pelvic floor preparation beyond endless Kegels and stretching on a birth ball. This video is for general education purposes. Your pregnancy history, your symptoms, your stage of pregnancy, and your clinical circumstances all matter. So use this information to start a conversation with your medical team and your pelvic floor physical therapist. Your pelvic floor is not a single on-off switch. It's a group of muscles with connective tissues that work with your breathing system, your abdominal wall, your hips, and the rest of your body. During pregnancy, it is responding to changes in pressure, load, movement, symptoms, and daily demands. During labor and birth, the job's a little bit different. The pelvic floor may need to respond to changing positions, changes in pressure, changes in sensation. It may need to relax to help with pain management and relax to move out of the way when pushing. That is why preparation is not automatically make your pelvic floor stronger or make your pelvic floor relax. The useful question can be, can your system respond and coordinate to the situation that matters to you? For one person, the priority may be managing pregnancy pain or pressure, but for another, it may be understanding pelvic floor motion, finding accessible labor positions, or practicing how breathing, pushing, relaxing the pelvic floor, and effort feel together. Those are different starting points and they deserve different plans. Kegels can be useful in the right context. They can help some pregnant and postpartum people train pelvic floor muscle contraction, which has evidence for preventing and treating incontinence. It's not about picking one breathing pattern or one position and treating it like the correct answer. Breathing can be practiced as a way to notice pressure, effort, rib movement, abdominal response, manage pain, and pelvic floor coordination. But the most useful strategy can change with the stage of labor you're in, what pain medication you're on, your level of fatigue, your comfort, and medical recommendations. The same is true for positions. A supported sideline position, a hands and knees position, standing, sitting, kneeling, or using a birth ball may all feel different at different points in labor. What equipment you're on, what sensations you have, your balance, joint comfort, what type of fetal monitoring you're on, and clinical circumstances can all change what is practical. So instead of memorizing the best birth position, practice a small menu of comfortable positions. Notice what feels accessible. Notice what support you need. Practice how you would get in and out of those positions. Then talk with your care team about what may be available in your birth setting. Birth positions are options that best support your comfort and your baby's optimal positioning. Pushing education should be more than cueing you to hold your breath and push, bear down and push like you're pooping, shouted at you for the first time while you're giving birth. It includes learning basic anatomy, what the second stage of labor means, how different breath and effort strategies can feel, how positioning may change the space and support available to you, and how to communicate when a cue doesn't make sense to you. It can also include an honest discussion about clinical context. Your options may be influenced and limited by your medical history, how you and the baby are doing, your sensation, the pain medication you're on, your level of fatigue, how you're being monitored, and the fetal position. Practice cannot guarantee that labor will follow your rehearsal. What it can do is make the language, choices, and body sensations less unfamiliar. This is why individualized pushing practice belongs with clinical judgment, not a viral 30-second instruction that assumes every body and every birth are the same. Where does your partner fit in? They do not need to become your doula or your clinician. Before labor, practice how they can help you change positions, adjust pillows, offer steady touch or counter pressure if you want it, protect the environment, keep track of the questions you want asked, and notice when you want quiet instead of coaching. Discuss how you will communicate to the birthing staff and when you'll give updates to your family at home. The goal is not for your partner to make medical decisions or perform clinical tasks. The goal is to practice support that respects your voice and can adapt when the situation changes. A 5-minute rehearsal before labor is much easier than inventing teamwork during a contraction. This is why having a birth plan and birth preparation is so important. A birth plan isn't a contract with your body, your baby, or the hospital. Think of it as a communication tool, a concise way to share your values, your preferences, your questions, and what helps you feel informed and supported. Birth preparation is the practice behind that document. It includes understanding your options, rehearsing support, learning how you want information explained, and talking through what matters if the original plan is no longer available. You can prefer an unmedicated birth and choose medication. You can plan for a vaginal birth and end up needing a cesarean. You can want one position and discover another is more workable. None of those changes mean you failed your birth prep. Changing the plan is not failure. Preparation is not control. It is building informed options and support for the birth that is actually happening. Pelvic floor physical therapy and doula support are not interchangeable. And that is exactly why they work so well together. A pelvic floor PT evaluates and treats within a clinical scope. During pregnancy, that includes pregnancy related pain or pelvic floor symptoms, movement and functional assessment, pelvic floor coordination, strength or mobility needs, and individualized birth positioning based on your mobility and your pushing preparation. A birth doula provides non medical, informational, emotional, and physical support. That includes prenatal planning, comfort strategies, partner support, continuous labor presence, communication support, and a postpartum follow up. A doula does not diagnose, perform a clinical assessment, prescribe treatment, or make medical decisions. Your medical team provides medical recommendations, and you remain the decision maker for your care. Some families need one type of support. Some may benefit from both at different points. The right path depends on the questions, symptoms, goals, location, timing, and current service availability. Generic birth prep information is a good starting point, but individualized guidance becomes more important when pain, pelvic pressure, leaking, constipation, movement limitations, fear of a specific activity, or uncertainty about pelvic floor coordination is affecting pregnancy or preparation. It also matters when you have a high risk pregnancy, new or concerning symptoms, activity restrictions, or questions about what is medically appropriate. Those belong with your obstetric or midwifery team first, and your physical therapist should coordinate within that plan. A prenatal pelvic floor PT visit includes a detailed history and functional assessment. A pelvic floor examination is not automatically done. It's done when it's clinically appropriate, it's explained, it's optional, it's always consent based, and always tied to your goals. If you're not sure whether you need a private birth preparation session, a prenatal pelvic floor PT session, doula support, or a combination of services, a consultation can help clarify the best next step without forcing every pregnant person into the same services. Here's the takeaway: preparing your pelvic floor for birth is not the same thing as doing more Kegels. It includes understanding your body, practicing coordination, exploring different positions and breathing options, learning what pushing education involves, giving your partner useful skills, and preparing to communicate when the plan changes. None of that guarantees a specific birth outcome. If you want help deciding whether birth preparation education, prenatal pelvic floor physical therapy, or doula support fits your needs, book a connection call using the link in the description below. And don't forget to like and subscribe for evidence informed pregnancy, birth, pelvic health, and postpartum education that respects both the research and the fact that Real Bodies doesn't follow a template. I hope you enjoyed this video, and I'll see you on the next one. Bye.